kind colleague, today I want to talk about the isolated corpus callosum agenesis. The prevalence of this malformation is 6-9 every 10,000. The inheritance is autosomal dominant, autosomal recessive, X-linked recessive and sporadic. The age of onset is neonatal or infancy. Corpus callosum agenesis is characterized by total or partial absence of the main interhemispheric commissure, the corpus callosum. Corpus callosum agenesis is the most common brain malformation. Clinical features include intellectual deficit and/or easily controlled epilepsy and/or behavioral disorders. However, clinical findings vary widely, ranging from asymptomatic cases with normal intellectual capacity to those with severe intellectual deficit. The ultrasound signs is failure visualization of cavum septum pellucidum, a borderline hydrocephaly, the colpocephaly, the third ventricle expansion, and finally the pericallosal artery absence. The case that I bring to your observation we will make many reflections. What you must affect immediately when you see this malformation, when you suspect this malformation, and it's important the word suspect, is that you see the absence of the cavum septum pellucidum in the median. Then you need to do a careful study of all the fetus. There are other signs that you can see. For example, you can see an hydrocephaly, usually really modest, borderline, that frequently interested occipital horns, but there isn't in this case. But if you pay attention on the median line, you can observe what kind of confusion there is in this particular zone. This confusion is linked to medialization of the frontal horns. There are little go up. You need to do a careful study of the anatomy, remembering that the confusion that you can see on the median line must put big apprehensions. You need to study everything. In this image you can see the cerebellum, and you must pay attention also on the cerebellum vermis. And why? Because the presence of associated anomalies of central nervous system is very high. And here you can see the principal sign, the absence of cavum septum pellucidum. In this malformation you can see also migration defects, and for this reason at 20 weeks you can see the insula. I showed you the sacrum, and why? Because there is the possibility of an association of spina bifida, though in this case we would have a malformation of the posterior fossa. I showed you the cervical part of the spinal column, and now we will repeat the principal sign. The absence of visualization of cavum septum pellucidum is the most important sign, but you can find other signs as the colpocephaly. You know that the occipital horns are more swollen as normally. In this case, the value is 9 mm. That is a normal value. But I show you this sign because you can find values of 11-12 mm, typical of this malformation. You can find frequently the frontal horns that go up and go forward and come near the median line, but in this case there isn't this problem. I show you the nuchal fold. I want to inform you that the patient have done the karyotype and the result is normal male. You can see the third ventricle that is normal. After, you can see the frontal horns. This is one, and this is the other one. The presence of a clear separation between the two brain structures tells us that the frontal horns are separated. Now you can see the third ventricle that is irregular. In conclusion, we can say that there isn't an hydrocephalus, neither a borderline hydrocephalus. And now I show you what you need to do many times. You need to do median section, sagittal section, to see the corpus callosum, that is a classical image of an hook that you usually see in your daily ultrasound examination and that you can see in this specific case. When you don't see the corpus callosum, you aren't sure and you need to be cautious. I show you this image many times, and why? Because you need to repeat many times this scan before be sure that you don't see the corpus callosum. You need to use also the color Doppler, and why? Because if the corpus callosum is present, you can see the pericallosal artery that you will not find in the corpus callosum agenesis, and this sign can help you in the diagnosis. In this image, you don't see the classical image of the hook, and then we are sure that we are in the right section. You need to do a careful study and observe all the fetal anatomy, and why? Because in half of the case there aren't associated anomalies, in other half of the case there are associated anomalies, and then it could be part of a syndrome, as for example the Aicardi syndrome, but there are many other syndromes where the principal sign is at the corpus callosum agenesis associated to other anomalies. In this image, we put the conclusive words after so many scansions that we don't see the corpus callosum. You need to do an echocardiography because in many syndromes frequently there is a heart malformation. You can see the septum primum and septum secundum. Now we see the left section. And now we see the right section. The three vessels. You need to see all the organs, and I show you the extremities, and why? Because in many skeletal malformation there is the corpus callosum agenesis. The most important examination that you need to require is the genetic counseling and especially magnetic resonance. And why? Because magnetic resonance can confirm us the diagnosis. I just said that the magnetic resonance is fundamental for the diagnosis, because if it confirmed this malformation, we are obliged to require a neurological counseling. Unfortunately, during the prenatal period, we can't know if this fetus will be affected by a big neurological deficit or a small neurological deficit. This is a difficult moment for you and for the patient. Your role is to advise the patient of the probable consequences of the disease that will be confirmed only by magnetic resonance imaging and evaluated by the neurologist. Thank you for your attention.